The IFS process has a specific sequence of steps. It starts with steps of getting acquainted with a part. It continues with the steps of getting access to a deeper, often hidden aspect of the client's personality, an exile, to free it from the pain it is holding. It's not a mechanical process, and some steps may often happen in a different order. The whole process might take much longer than one session, maybe 1,000 sessions, maybe more. The final goal is for the client to build relations of trust with their parts and to make place for more self-energy in their system. Safety is crucial. Anytime you have any doubt, feel unease about answering a question or looking inside, voice it. It's always beneficial to stop and make sure you feel safe. What would a first IFS therapy session look like? The IFS therapist or practitioner will start with a standard interview. As a minimum, they may ask you about your past and current therapeutic experience and medication. The next question you might expect during your first IFS therapy session would be, what is it that made you contact me? You will be invited to introduce your topic, to paint a larger picture of your internal landscape. While listening to you, a therapist may identify different elements of your personality called parts and how they interact with each other. Depending on your experience with the IFS model, they may give you a short introduction to the model and explain the flow of the session. If you are willing to proceed, you will be asked to name a part you would like to know better during the first IFS session. You will be asked when and how it manifests in your life, and if it's okay to get to know it better now. The next step is a U-turn. By turning your attention inwards, you check if you currently feel the specific emotion or bodily sensation associated with that part, or if you can recall such a time. Once you locate the part, you may be requested to ask it about what it is doing for you. It is important to understand the intention of the part. The therapist or practitioner will invite you to initiate a dialogue with the part, starting with the questions. Ask the part. You may choose how much you want to share and how much you want to keep for yourself. A very frequent question in the IFS process is, how do you feel towards this part? It is meant to invite more self-energy in contact with the part. Independently of how far you reach during the session, the therapist, practitioner will make sure you and your parts are safe before the closure of the session.